Welcome to the Personality Couch podcast, where we discuss all things personality and clinical practice. I'm your host, Doc Bach, and I'm here with my co-host, Doc Fish. We are both licensed clinical psychologists in private practice, and today we continue our series on schizoid personality. What is a schizoid, you ask? Well, the schizoid in our lives is the family member who doesn't attend social gatherings, or if they do show up, they sit in the very back and appear disengaged. It's the client who has a hard time opening up in therapy and letting you in. It's the friend who knows how to fix your computer and speaks code better than small talk. Schizoids are kind of the misfits and misunderstoods in our society. So let's unpack the history of this personality, the psychodynamics of the schizoid, and our interpretation of their complex inner workings. Let's get to it.
I really think that schizoids are the most misunderstood personality.
Yeah.
Researchers even note that it's easy for providers to look at a schizoid individual like a case or a specimen instead of the actual human being that they are.
Oh.
And it's all because most people cannot understand a schizoid's experience.
Right. And that's not really helpful. And honestly, a lot of the earlier research on schizoid has only contributed to this stigma, which is why we're doing this series. So if you are a schizoid, we hope that you find this series validating. And if you have a schizoid in your life, we hope you are better able to understand their needs.
Okay, so let's dive into what schizoid personalities look like. They are extremely sensitive souls who use withdrawal as their main defense against an overwhelming world. So internally, they're very sensitive and easily overstimulated. They can come across as shy and socially backwards, and they experience emotions so powerfully that they feel they have to separate from that. They fear closeness, but they also long for closeness, which is a source of internal conflict.
Right. Yes. So then externally, they can seem more cool and detached from others. So others probably feel like they never really get to know them. They can also seem unresponsive emotionally, even to major life events like a funeral or a wedding. However, research and our clinical experience does not support that schizoids are unemotional. They actually experience very strong emotions, but they won't let you know it.
Schizoid personalities are often confused with autism, though they're not the same, which we'll have to dive into much deeper in a different episode.
Yes, absolutely. That is a big one that gets misconstrued. Yeah. So another one is that schizoids are also confused with schizophrenia, but they are not the same thing. So the schizoid personality can disintegrate into schizophrenia at really unhealthy levels. However, your average schizoid is not psychotic, but schizoids are misunderstood for many reasons, including this sort of psychosis connection. But we also experience them as odd, and then that different is seen as inferior.
McWilliams draws a parallel between sexual minorities' historical stigmatization, misunderstandings, and tendency to overpathologize their experiences. She notes that schizoids, as a minority of personality, feel deviant and feel like it's unsafe to come out. Their introversion and internal dynamics are odd to those who have difficulty understanding them, so they're overpathologized.
This makes so much sense. And I can see this with the schizoids that I've known personally and also in clinical practice. Again, they're seen as different and then don't fully feel safe being themselves. And then I also think about the American culture. We're very extroverted and narcissistic. We like to shine and take the spotlight and talk a lot. Schizoids are like the opposite of all that. They are quiet and reflective, not shiny and intrusive.
Right. And I think an interesting side note, she also mentioned that schizoids have a radar for detecting other schizoids, kind of just like the gaydar of those in the LGBTQ plus community.
This is so interesting. Yes, it's like a quiet, I see you, or I get you.
Mm-hmm.
So theorists both then and now have had a hard time wrapping their head around this type, especially given the juxtaposition of their internal world versus how the social world experiences them. So let's start by visiting some of the cool names that theorists came up with as schizoid was just being discovered.
Sure. So, schizoid as a personality type started with theorists around the late 1800s, early 1900s, and they observed a pattern of personalities that were quiet and reserved, eccentric, seclusive, serious-minded, and unsociable.
Yep. And then we started looking into schizoid personalities since these unsociable types didn't seem to fit into the traditional Freud psychoanalysis box that was so popular at the time.
Right, because schizoid personalities were difficult for the theorists to understand. There were no roots in the libidinal or psychosexual development. Big words. But what this really means is that schizoids were detached from the sexual and aggressive drives that Freud conceptualized and that were part of early psychoanalysis. So the real work on schizoid began with hypotheses and object relations, which looks at attachment versus the drives in understanding personality.
Yes, that's key. Attachment. So a few theorists weighed in on some interesting names at the time. So some thought that there was a personality that was predisposed to schizophrenia and psychosis. The first one was Kahlbaum. Well, maybe he wasn't the first, but he was a notable one to us anyway. So Kahlbaum, in 1890, with the cool name, he introduced the term Heboid to represent the personality pattern that was structurally connected to clinical hebephrenia, which later we called disorganized schizophrenia.
So he noticed that split between the self and others. Then in 1910, Hoch discovered a shut-in personality who did not have a natural desire to connect with the environment, being reclusive and stubborn and inflexible in like a passive way, basically like impermeable.
Ooh, that's interesting. Okay, it sounds like they're onto something. Then we have Kraeplin, who around 1919 thought that there was a mildly defective personality style that stopped just short of breaking with reality, as in schizophrenia. So he noted that these types were prone to fantasy and their own internal thoughts versus engaging with the outside world.
Bleuler in 1922-29 used the term schizoidie to describe that shut-in, suspicious, comfortably dull person who might be incapable of discussion.
Right. I still use the term schizoidie to describe schizoid-like features. So good job with this name, Bleuler. But essentially, the external world does not influence them. They are comfortable being boring and dull, and in fact, they prefer it as it doesn't draw attention to them. Withdrawal and indifference is their defense mechanism to keep them safe, but it doesn't mean they don't care.
Right, it's the external side, not the internal.
Jung, interestingly, who was Bleuler's student in 1921, came up with a description of introversion that matched others' understanding of schizoid. Some think schizoid is pathological introversion, but this is controversial in some circles.
It is. So Jung, describing schizoids, quoted, "They are mostly silent, inaccessible, hard to understand. They neither shine nor reveal themselves. Their outward demeanor is inconspicuous, with no desire to affect others, to impress, influence, or change them in any way, which may actually turn into a disregard for the comfort and well-being of others. One is distinctly aware then of the movement of feeling away from the object."
Ooh, that is so interesting. Okay, so the other person in the relationship is aware of the detachment, or how this schizoid person moves away to be inside the self.
Then in the 1930s, Menninger noticed that this personality was multifaceted. It presents a certain shell to the world, but has more than meets the eye on the inside, much like a turtle when you only see the shell. So he described this as a false exterior with a genuine core.
Interesting. I can see how the defense mechanism of withdrawal is only part of the story. Like, it's not the full picture. So in other words, these schizoid personalities are multifaceted. Like, they're not necessarily insincere. I don't think that's what he's saying here. Just complex. Like, there's more there than you see.
So that's a great transition to Winnicott, who proposed that schizoids have a false self that protects their true self. I personally think that schizoids don't have the energy or the care to put into this mask or that false self. That mask portrays a lack in emotions and interpersonal skills.
Yeah, false self. I actually struggle with this language because the schizoid type, in my experience, is real. But the world only sees part of that picture. And I think that's what he's saying here. So the schizoid type isn't trying to be inauthentic. Like, they're just not putting effort into what the world sees. And that's exactly it. Like, that no effort comes out as indifference.
Let's jump to 1952 with Guntrip. So he saw these personality types as neutral observers who kept their distance and were out of touch and, again, seemingly different from other people. I think this is fascinating. So the patients that he was treating called their experience depression, but he noted that it lacked that heavy black inner sense of brooding, of anger, of guilt that shows up in classic depression.
Ooh, that is really interesting. So I think back to the concept of anhedonia with schizoid types that's actually in the DSM definition. So anhedonia is lack of pleasure. Anhedonia is also a criterion for depression. So a person lacks joy or pleasure in activities that others typically find pleasurable. So certainly that can be part of depression. And it can also be what the schizoid type is allowing the outside world to see. This sense of like, I'm apathetic and uninterested, when really that's just part of the story. It's not the full picture.
Right. Then Guntrip also added to our understanding of schizoid with the classic dilemma of the schizoid individual, noting that he can neither be in a relationship with another person nor out of it, without in various ways risking the loss of both his object and himself.
This is the conflict between closeness and distance, but also love and fear.
So like porcupines on a cold night, schizoids choose to be cold and distant so that the other person doesn't intrude on them with like their pricklies.
So I think of McWilliams here, who says, "Come close, for I am alone, but stay away, for I fear intrusion."
So another super duper interesting side note, Guntrip apparently stated that psychoanalysis is a profession by schizoids for schizoids.
Oh, wow. Okay.
Yeah, so research has shown that female therapists trend towards a more depressive personality, but male therapists do trend towards schizoid personalities.
What?
So my favorite part is that this makes sense because therapy, like as a therapist, creates an environment where social needs are met and allowed to occur in a setting that is obviously strictly boundaried. It's one-sided. So there's intimacy, but no impingement.
This makes so much sense. Oh my goodness. Okay. So I'm thinking about what we talked about in the last episode, which was that many schizoids can be found in math, science, technology, engineering. But what you're saying is if they don't go that route, they're probably a therapist.
Or a philosopher opining on these topics, yes.
Right. Yeah, this is so interesting. Okay, so going back to the researchers. So Akhtar, 1987, 1992 timeframe, he's actually made many contributions to the field of personality psychology and specifically personality disorders by describing their overt, observable, and covert, or under the surface, qualities.
So schizoid personalities to the outside world, so overtly, seem detached, boring, scattered, very moral, and asexual. Under the surface, though, or covertly, they're extremely sensitive and, quote, emotionally needy, acutely vigilant, creative, often perverse, and vulnerable to corruption.
Interesting. Yeah. So no one sees what the covert is, though, like under the surface. And again, as for schizoids, what the world sees is only part of that picture.
Right. So we have the split of the self and the world, and then of the self and their needs. So the schizoid sensitivity, emotionality, perversion, it exists, but they can separate from it. They don't reject or deny or project it. They just withdraw from and detach from it.
Right. So then the world is left viewing the shell, just part of the picture, but not the full story.
Exactly.
Okay. But then let's fast forward. The real star in understanding the schizoid personality, in our opinion, is Nancy McWilliams, who came on the scene in 1994 with literature that really tried to capture the inner workings of the schizoid.
Yeah, McWilliams supported the conflict-based approach instead of the deficit approach. So the conflict is between wanting closeness but finding it dangerous, leading to withdrawal. So schizoids are scared of being overwhelmed, consumed, engulfed, and so they choose distance.
Yes, and this conflict is thought to arise from early attachment and what is called micro-dissociations from an ill-suited parent for the highly sensitive child. Okay, in other words, the very sensitive child learns to resort to their own internal world since their real world is either too threatening, too neglectful, or a combination of both. And then out of this early attachment trauma, the defense mechanism of withdrawal comes into play, and the schizoid individual often uses fantasy and dissociation to cope with the very overwhelming social world.
And this is why they have fears that all involve connection with others. Because in a relationship, they could be engulfed or enmeshed or overstimulated, intruded upon, traumatized, controlled, etc.
Right. So going back to early attachment, it's the relationship that's threatening. It's scary.
Yeah, their attachment to others could then obliterate their self, identity, individuality. Others in the world could consume them to a point where they no longer exist. So there's that fear of going to pieces, and they can even try to physically hold themselves together by wrapping in a blanket or going into a closet or just wearing a coat all the time.
That is so interesting. So actually creating this like physical shell for themselves.
Yeah, there's a strong need to protect their core, to be anchored and like held together.
That is so interesting. Very similar to a turtle in the turtle shell. Yeah. And I can see how being like such a misunderstood type would contribute to that fear. Like schizoids do not want to just be like the rest of the social world. And I'm going back to that like cloaking, like physically cloaking themselves oftentimes, like finding some type of actual physical protective shell as an outer garment to protect them from the social world. Like that's interesting.
Yeah. And then this is why they tolerate abandonment or distance. And then they seek strength and identity in being alone.
Now I think of the Psychodynamic Diagnostic Manual here, which tells us that at more severe levels of schizoid, they may have some like oddities or little idiosyncrasies that actually serve to create a tolerable level of space between themselves and others. So this doesn't come from deficit or ignorance of social expectations. It's just a way to keep others at arm's length.
So that makes me think schizoid is essentially the opposite of histrionic.
Oh my goodness. This is so interesting. Tell me more.
Okay, so in contrast to histrionics, schizoids are like repulsed or repelled, scared, disgusted by fusion with others. So then they reject any of their own dependency or neediness or clinginess.
This is so interesting. Yeah. And I can see how this like opposites attract dynamic would look like a distancer pursuer relationship, which is so common in couples therapy.
McWilliams actually wrote a bit about the schizoid hysterical romance, and she even proposed that there's a histrionic inside of every schizoid and vice versa.
This is just so fascinating. I wish we could talk about this more, about how personalities attract one another and that schizoid hysterical romance, but save it.
Right.
We'll save it.
Maybe in a new episode. That would be fascinating. But let's talk more about the schizoids' defenses and how they cope with this world that's so threatening to their existence.
Yeah. So we've already talked about this a little bit, but withdrawal is a big one. And it's to minimize stimulation and intrusion and separate the self from the world. So this is where we see them physically going away or resorting to fantasy or into their own minds for that stimulation.
Yeah, the separation allows them to sit in the logic and detach from any overwhelming emotions, which could also be called intellectualization.
Right. So these types can seem more heady or intellectual, which is a way to keep from getting too pulled into emotional content. So keeping the social content on a cerebral level versus emotional level, like it feels safer for them.
Yeah, but then this can come off to other people as like a flavor of narcissism.
Yeah.
Or like an isolated superiority. But really, it's just a reaction to others' impingement and attempts at control. Like, how dare you force me into social participation? Like, social scripts are silly and I refuse to engage.
Right. But it can come across as intellectual superiority. Like, I'm not engaging with that because I'm better or smarter. Like, others can at least see it that way. I don't know that schizoids actually are thinking that, but it can come across to other people that way.
Sure. Because really, on the inside, they're just trying to preserve their own sense of self by staying at a safe distance from the rest of humanity, which is super interesting, actually, because even like schizophrenic patients are often quite oppositional and stubborn. So not dangerous, like not like fighting for power, just I'm in my shell, go away.
Right. Yes. And then there can also be like a disregard for conventional social expectations because they reject being defined by others. So being defined by others would mean that they aren't separate, so they don't exist. And then social constructs are seen as like contrived and forced. And they're so not about that. Like they don't care. Like you said, I'm in my shell, go away.
Right. And then no wonder there's like an indifference to and outright avoidance of attention and admiration. They want to be ignored in their own little shell, not celebrated. They want space and they have no need for any kind of narcissistic supply. Their self-definition is internal.
Right. So their needs for validation come from within the self. They don't need social accolades any more than a turtle wants you to pet them.
The turtle does not want you to pet them. They don't like it. Don't pet the turtle.
Exactly.
Anyway, another way to understand this is that we have a mom who wants her child to be her, to enmesh and not to be its own separate being. So then her external approval and criticism becomes threatening to the child's own sense of self. So the child has to reject it. The child finds their own way and leans on their own perspective of themselves in order to exist and develop a sense of self.
I can see how this could become like an obsession. So the schizoid has to find their identity separate from the social world. So they work really, really hard to fortify and strengthen their internal pillar called self. So like constantly adding to it to strengthen it. Almost like how we would fortify and strengthen castles in medieval times, like use the best materials so you're not overtaken from the outside in.
Exactly. Like fortify that shell, protect that inside core sense of self. And sometimes I think they can overcompensate in their pursuit of like authenticity, being actually really highly self-critical, and they can become very isolated and demoralized. Now, interestingly, at least to me, in McWilliams' book, the only personality that she differentiates between schizoid is the obsessive compulsive personalities.
Now that is really, really interesting. And I think this is where we have to look at the motivations of the personality shell. Like personalities are a gobstopper, right? What's on the outside doesn't necessarily match what's on the inside at the core. So here we have to look at, does the shell exist to bring people in or to keep them out? If it's to keep them out, it's skis. If it's to bring them in, it's compulsive.
Exactly. And so again, it's really important to understand the defenses and how schizoids cope with the world to get a peek into what they're protecting inside their minds or the shell. I picked out a couple quotes from McWilliams and one from Milan that I think really highlights the internal understanding of a schizoid.
Okay.
So the first one from McWilliams is, some schizoid individuals feel pain of an intensity so excruciating as to require their defensive detachment in order to endure it.
Wow. This actually reminds me of borderline. Like, we're not talking about the same personality by far, but the oversensitivity to the world, like everything hurts. So with the case of the schizoid, though, they withdraw and dissociate to cope.
So this does go along with my favorite quote ever about schizoids from Milan. So he said, when the going gets tough, the schizoid gets going.
Okay, that's great. Thank you, Milan. Yeah. So basically, when it gets hard, the skis withdraws. So if you're married to a schizoid, you may not see them for stretches of time when there's a lot going on at work or home.
Right. Okay. The last one from McWilliams is that schizoids are startlingly aware of features of their inner lives that tend to be unconscious in individuals with other kinds of personality.
Because they spend so much energy exploring all the nooks and crannies of their ultra fortified mind castle. Like they know every thought or fantasy or tendency, and they're not afraid to go to that cobweb filled room that others avoid, like, or to fantasize about taboo things because it's a castle and everything is safe for exploration, including socially forbidden topics and thoughts.
Exactly. So they have no defenses against all the things others are able to avoid in different kinds of ways. So let's think about this. Like, we are all boxes of crayons. Every human, every personality originally comes as a full box of crayons with all of the same colors. But through temperament, attachment, environment, and experiences, we all learn to use our colors differently, resulting in those different defense mechanisms, like denying the existence of colors or projecting them or hiding them.
Yes. Yeah. So most temperaments will pull out some colors from the crayon box or throw them out or maybe favor some hues over others, but not the schizoid. Like they hoard the whole box of crayons inside and you never know it.
Right. But then the schizoid is also like, how do you all not understand that we all have all of the colors?
Right, right. So using another metaphor here, like in the card game of life, schizoids understand that the full deck comes with 52 cards. So they know when someone is holding an ace up their sleeve or threw out all the wild cards. Like they see when someone is cheating through life by using defense mechanisms.
Yes, yes. So schizoids are actually super colorful on the inside, but they keep their box closed.
Right.
They only show their external box, which lacks color. And then that obviously can be off-putting to others, but it does work in their favor because then others are not intruding on them.
Right.
No one wants that like boring gray box of crayons over there. They don't want to open it up. No one wants to pick out a color or throw it back in their face, or really just no one has anything to work with to intrude upon them.
Right. Yes. Yes. But inside of that box, if you ever have the privilege to see it, it is filled with color, intricacies, and intrigue. Like imagine getting to color with all the hues in the mind.
Because they're not threatened by any color. they have all of the colors. They're in tune with their black darkness, perversion, destructive desires, or their gray nihilism, or with their red potential for passion and anger. So there's no denial of any color like other personalities might do. It's just a detachment. I think that they color with all of the colors in their head, like in fantasy, but not in real life.
Right. The fantasy world is rich and vibrant. Yeah.
McWilliams notes that they have access to their madness and may feel like they're on the edge of psychosis or insanity, which I think, again, is because they have access to all the colors. I think it's easy for them to feel others might be gaslighting them or to feel like they are the one who is crazy because, like, how can others not see the colors? Like, how can other people lie to themselves like that?
Right. Yeah. So let's bring this back around and tie this together. So the skis, because they have access to all the nooks and crannies of the human psyche, it gives them a hypersensitivity to spotting others' fakeness. Like they can sniff out a rat. Or in other words, one of their superpowers is being able to spot others' defense mechanisms.
Okay, so then this creates two things maybe. So one is a pushback against social scripts because they're not authentic. And then two, at times, it can create a lack of empathy for others' inability to see their colors.
Yes, I can see how that would be the case. Yeah. All right. So bringing this kind of all into focus and summarizing what we talked about. So schizoids are complex personality types that are grossly misunderstood in our social world. And psychological research has done no favors in continuing to misinterpret and misattribute the observable behaviors of the schizoid.
And researchers seem to act just like everybody else, putting their own colors onto the schizoid instead of taking the time to explore inside the shell.
Yeah.
We do have to hand it to the psychodynamic guru, Nancy McWilliams, who has given us a better understanding of the complex inner world of the schizoid. So we now understand that schizoids have a rich imagination and strong emotions and social perceptiveness, so attuned that they protect themselves by withdrawing and detaching from their own needs, from others, and from the world.
Yes, yes. And I would guess that McWilliams was able to bring us such thorough research since she reportedly is or was married to a schizoid who probably felt like Nancy was safe enough to be able to explore inside the schizoid shell. So, but even still, thanks to her patience and persistence, we are better able to understand these types in relationships and in clinical work. And on that note, that's a wrap. So thank you for joining us today on this episode of The Personality Couch. Make sure to check out our blogs that coincide with these episodes at www.personalitycouch.com. And as always, don't forget to give us a thumbs up or rate and review us on your favorite podcast app. And on YouTube, hit that bell so you don't miss a single episode of our Schizoid personality series. Be well, be kind, and we'll see you next time on The Personality Couch. This podcast is for informational purposes only and does not constitute a professional relationship. If you're in need of professional help, please seek out appropriate resources in your area. Information about clinical trends or diagnoses are discussed in broad and universal terms and do not refer to any specific person or case.